Uh, Hello, everyone. I want to welcome you all. And, in honor of Mental Health Awareness Month, we're going to focus on mental health and well-being today. We're very fortunate to have some really stellar presenters with us to set the stage and let's tell us about how we are going to work to support mental health and well-being in the workplace, as well as how children are being impacted by the pandemic, and how we can best work to advance their mental health and well-being as well. Since we're trying to keep these meetings down to about an hour, I want to get us really started here. I think first we're going to start the meeting with a quick update from our colleagues at IP3 about our FERN project, and as many of you know, that's our network mapping project. And then we're going to follow that with our colleagues from the American Psychological Association and the American Academy of Pediatrics with a group discussion about what you're seeing in your own organizations and how we might work together to try to address some of those mental health challenges and opportunities. We're also excited we have the opportunity to hear about an effort of our CEOs focused on improving mental health supports for their own workplaces and reducing the stigma around mental health. And APHA is really proud to be part of that effort with the American Psychological Association. And we certainly want to share some of those resources with you today. And we're also going to cancel our Alliance meeting next month because we've got the APHA Policy Action Institute on June 14th. Hopefully all of you will be able to attend that. And then a second meeting focused on the challenges of the Public Health Authority on the 15th. So we hope to see many of you there. So with that, I'm going to turn things over to Aaron and Shara to provide a quick update about FERN and soon to be released network mapping project. Ladies.
Thanks so much. So glad to be here. Let's see, make sure I'm sharing everything. Nope, slideshow, I'm hitting the wrong button. Okay. You guys see the screen okay? Okay, terrific. So I'll make this quick. You guys have a great and important agenda to focus on. So just wanted to give you a couple of quick updates and highlight a couple places where we could use your help as we get ready to launch the network mapping tool and continue to spread the word about the resource navigator itself. So a couple updates. One is that we've got the tool, we've got the interactive link that we'll drop into the chat here in a moment, but we still need some more content. So we've got all of the Alliance members on the map. We've taken an initial cut to identify topics and sectors where you're working and even identify a couple sample initiatives. But we have a couple places where we'd like some input from you guys, and I'll talk about that in just a moment. But before I do, just to kind of show you the structure of the tool itself, all of the Alliance organizations are plotted on the map. And by the way, this is not exclusive to the Alliance member organizations. We're starting there, but certainly feel free if we can, continue to expand who's on the map to include some additional stakeholders that you're working with. It's not exclusive, so we can definitely continue to grow from there. But we also have the content organized by the different topic areas. So as you know, with our resource navigator, we've got content organized by a series of topics such as building trust, public health authority, vaccination, and so on. So this is an example of what a screen looks like when we look at the building trust topic area, and we can see initiatives and organizations that are working on that, dig in to find even related. So if you're looking at building trust, for example, you might also want to go look at public health authority. So as we continue to bring in additional content, this will just get more and more rich in terms of the connections that we can build there. Also, we can plot initiatives. So our friends at Made to Save, as an example, we can look at initiatives like this and see the activity across, across the nation, or where you might have some place-based initiatives. So in addition to your organization, we want to know more about those kinds of place-based efforts that are happening and who you're partnering with locally so that we can really lift that up and see the scope and the breadth of all of those activities. So how you can help, we have a couple links that we're going to share with you. One of them is a survey survey to validate the information that we have for your organization on the map. So we've got some basic information, location, description, the topics where you're working, and sectors based on our assessment. We definitely would like to validate that before we make this live. So this is your opportunity to kind of confirm that that looks okay before we go ahead and publish the map. Also, importantly, there's some questions in the survey that talk a little bit about how well this achieves some of the goals that we set out to do. Really trying to get some strategy cohesion across the network to understand the breadth and depth of all of the work that you're doing, really surface partnerships and collaboration opportunities by having all those interconnected pieces. And we'd love to know if we're getting, how close we're getting to those. And definitely open to all sorts of feedback, constructive ideas, anything like that. So the survey will ask you kind of your thoughts on how well this is getting at, and if you have any other ideas for us. Another thing you can do in addition to or instead of the survey is book some time with us. And so we've got a link to a bookable calendar to just sit down with us, 30 minutes, we'll walk you through the tool. We can update your information right there, get feedback, hear what your thoughts are. So if you'd like to point us to someone on your team to do something like that, or if you'd like to have some time, if that's easier, happy to do that instead of or in addition to the survey. So those two links we'll share in the chat as well as part of the follow-up information. Also wanted to give you just a quick update on the Resource Navigator as a whole. So we have launched in National Public Health Week. We've had about 2,100 visitors since launch. We've had a good chunk of folks finding us through LinkedIn. So those of you who have shared the information on LinkedIn, thank you. That seems to be working nicely. Also, a number of you have actually included a link to Fern on your websites, which we really appreciate. That's definitely helped with traffic. But we continue to need this organization to help spread the word. I know we got through National Public Health Week. There was a lot of stuff happening, a lot of activity kind of, would like to continue to spread it so it doesn't get too drowned out. So we have a few resources that you can use to share. And if you do go ahead and share anything through social media, on the media kit, we have some tags you can tag us in so that we can actually kind of share that you shared it and build some interaction, which will help boost that. So specifically, we have a media kit, which we did distribute during or right before the National Public Health Week. We distributed it to the communications contacts that we were made aware of. That is still super relevant, and there's lots of good stuff in it, including slides that you can include in a presentation that if you're going around, you might want to spread the word about. Also has some newsletter blurbs. So I know our team is always looking for things that we can promote in our newsletter, maybe your teams as well. So it's got some ready to use content that you can just drop right into a newsletter blurb. And that's a really great way to kind of share that this exists, as well as social media posts, all sorts of good images, etc. So that's all there. Again, we'll drop the link to this and include it in our follow-up email. And if you do have a communications contact that you'd like us to talk to, feel free to direct us there. We're happy to do that as well. So we just really appreciate all of the shares that we've had so far. And then the last thing I'll just mention is we are looking to a second phase of this Resource Navigator work and the network map. And so this is a great time to give us some feedback. The goal of this is to make it useful for all of us here, everyone around the table, and of course, create the most impact that we can. So if you have any ideas for us, it would be really cool if you could do this. Let us know. This is a good time as we're kind of planning for our next round of work. So that's my quick update. Susan or Angie, do you have anything else you'd like to add?
No, thanks. I think just really to keep in mind, one, thanks to our colleagues at IP3 for all they've done. As you can see, we've really moved a long way since we got started. But as they said, we really are trying to figure out how to make this as useful as possible for everyone. So please share resources with us. Please give ideas of how this can be useful. We really are trying to figure out how to make it all over our resource and make sure that we get the information and the context that we need to make this as useful as possible for everybody. Any quick questions from folks or suggestions? We really appreciate all of your help in making this relevant and valuable. Okay. Thanks, ladies.
Well, great. So thanks, everyone. So now let me have the pleasure of introducing our presenters who provide a short update about what they're seeing in the field around advancing mental health and well-being in the communities, particularly our workplace and also our kids. So I think we're going to set the stage with our colleagues here from the, we're going to go with Dr. Wright, I believe, who's the Senior Director of the Office of Healthcare Innovation, and Dennis Stoley. Dr. Stoley is the Senior Director of Applied Psychology at the American Psychological Association. Thank you. Turn it over to you two.
Great, thank you. It's a real pleasure to be here while I pull up my screen. I'm sure that'll work in a minute. There we go. Okay, can everybody see my screen? Okay, thanks. Thank you so much for having us today. I'm going to start us off with just
Can we actually see your agenda rather than the slides?
Oh, okay. All right, 1 second. Let me stop sharing and try that again. And what do you see now?
There we go.
Okay.
If you put it in this,
Will do. Yep, just give me 1 second for it to respond. Okay.
There we go.
Perfect. Okay. So I'm going to start again. It's a real pleasure to be here. I'm going to start us off by talking really briefly about our APA Stress in America survey, and in particular, our most recent data. But just to give a little bit of background, we've been doing Stress in America for about the last 15 years. I've been part of the team for about the last 7. And the goal is really to seek to draw a connection between the mind and the body. And so at its core, what that's looked like is asking Americans, a nationally representative sample, to rate their stress on a scale from 1 to 10, to tell us what types of things are causing stress, and then to tell us what kinds of things they're doing or not doing to manage their stress. We work in collaboration with Harris Poll, and we have a very multidisciplinary team that works on this, engaging in a very robust methodology. This is an annual survey. Each year we've typically had a theme. Sometimes it's been money, sometimes it's been health. But when the pandemic hit, we switched our methodology slightly to engage in more frequent surveying so we could get a real pulse of what Americans were going through during the pandemic for the last 2 years. So the data I'm going to present is the data from the 2-year pandemic anniversary. So this is data from about February, March. And what we found was that although stress about the pandemic itself has decreased since the beginning of the pandemic, things like inflation, global uncertainty, and the invasion of Ukraine were significant stressors, being reported in numbers like we haven't really seen before. So when we've asked about single stressors in the past, high-level stressors usually resonate for about 65, 67% of respondents. Here we're seeing 87% of respondents saying that the rise in prices of everyday items due to inflation was a significant source of stress. I'm not going to go over every data point over these slides. We can provide the slides to you, and also you can go to stressinamerica.org in order to get the full report. But I think what's important here is the universality of some of these stressors, that it's across the partisan divide, that everybody's really experiencing concerns about supply chain, about the invasion of the Ukraine, and this kind of culmination of these constant crises over and over and over again that I think is driving stress, particularly right now. I think for this group, what might be really interesting is when we drill down into COVID itself, what we see is that the divide in the country as it comes to COVID is really causing strain on relationships. So 58% reported experiencing relationship strain as a result of conflicts over the pandemic. So that can be things like differences in mask wearing, in the health risks, and what that pandemic is overall. And I think that's really important from a public health point of view, that it's not just that the way we message this and the way that people engage in protective behaviors, but it's the trickle-down impact impact that that has on families. And we know that relationships are a huge buffer for stress. So when they're strained, that makes us at APA really concerned. I think one of the highlights or sort of positive aspects of the study is that 40% said they connected in new ways. And while we don't know exactly what that looked like, I know for me and my community, it was a lot of neighbors coming out and meeting each other for the first time, dog walkers meeting in parks. And so I think that when we're talking about the impacts of the pandemic, we want to be balanced in some of the ways that we talk about it. Again, the second really highlight that I wanted to bring to this group is the ways in which parents expressed a lot of concern about the development of their children, in particular their social development, academic development, emotional, cognitive, and physical health. And I think we're seeing this really borne out, at least anecdotally, in the stories coming out from teachers in the schools, that kids seem to be about 2 years delayed in every aspect, from pre-K all the way through college, that you're just seeing a real impact on the pandemic on children in ways that I think will probably have long-lasting effects, particularly public health effects. And so why does all this matter? Well, because it culminates into unhealthy coping behaviors. In particular, what we saw in the survey was undesired weight changes, so either eating too much or not eating enough, or drinking. And again, these are also supported by external research sources that we've seen. But the thing I want to highlight most here is that these numbers are almost the exact same numbers we saw a year ago, which suggests to me as a psychologist that these have become habits. And habits, of course, are so much more harder to change and redress than, point in time kind of unhealthy coping behaviors that you might see in acute periods of stress. And instead, what we're really looking at is prolonged stressful periods. And so I think, I'm going to close here and give it over to my colleague, Dr. Stoley, so he can really talk about how this has manifested in the workplace. But I think this will come to no surprise to everybody that the majority of Americans say that their life has been forever changed by the pandemic. Not necessarily changed only for the negative, just changed in general. But again, I think that one of the positives that we saw in the data, at least, was that 71% say that they got better at prioritizing what's important to them because of the pandemic. And I think that that really plays out in the workforce and in our work-life balance and as we think about the future of work. And so for there, I'll stop. We're going to have time to answer questions, of course, and to have a really rich discussion. But those are just some of the data that I wanted to make sure that we shared to set the stage for the conversation that we'll be having. And so with that, I will turn it over to Dr. Stoley.
Thank you, Bill. Good afternoon, everyone. I want to thank you for inviting me to be here this afternoon and to speak with you. I'm going to narrow the focus just a little bit to zero in on stress in the workplace. And I'm going to share my screen here if I'm able to. And if you could, someone could just confirm that you're now seeing my screen.
Yep, you're good.
Okay, thank you. Similar to how APA does our Stress in America survey annually, we also do a separate survey that focuses specifically on stress in the workplace. And so it's a little bit different in that we are only surveying adults in the US who are employed to try to get a feel for what's happening in the workplace. And our last set of data is from 2021. And one of the things that we found in that data was that roughly 6 out of 10 workers said that they had experienced negative impacts of work-related stress in the last month. And so, that alone is an interesting statistic, but it, in my mind at least, raises the question of, okay, well, what does that really mean? Well, we also asked about intent to seek new employment. And we found that 2 in 5 of our respondents were planning to seek new employment within the year. And that number is up from what we had seen in past surveys. In 2019, for example, we were seeing 1 out of 3 as opposed to 2 out of 5. So Now we have two different data points. We've got a data point about people experiencing stress in the workplace, and we've got a data point about people planning to seek new employment. So the question becomes, are they connected? And in fact, they are. What we saw in our data is that those who typically feel tense or stressed out during the weekday are 3 times more likely to be planning to seek new employment. And so one of the things that that means for employers is that stress in the workplace is a major talent retention issue. And this is consistent with what I think we've all seen in the media and experienced in our own lives, that some have termed the Great Resignation, or others have referred to as the Great Reshuffle. But from a business perspective, it means that employers need to take action, and they need to take action now, because that's going to result in long-term savings. It can be a lot more cost-effective to try to deal with these issues up front than it is to deal with turnover and the need for hiring and so forth down the line. One of the things that we have done in partnership with APHA and other organizations, including NLC and YMCA, is that we've teamed up to develop resources and make them available for free to employers, to really allow employers some insights into, well, what can they do to try to achieve excellence in their workplace. And we've put these materials on the APA website, and we are providing specific concrete actions that employers can take. And we're also providing information about the science that backs up taking those actions, and concrete steps that employers can do as a practical matter in their own workplace. And so what you're seeing here on the screen, for example, is a screenshot from one of the web pages on the APA website. And it provides these various actions that can be taken, and a person can click on any one of these actions and drill down to get more detailed information, more concrete information. Another thing that we've done to really bring this home for employers is to highlight certain organizations that are already leaders in this space, and put up stories about what they're doing and the effect that it's having in their organization, to serve as an example for others on what they could be doing. One of the multiple organizations that we highlighted on the webpage is EY, Ernst & Young, the large accounting firm, which has really taken some interesting and innovative approaches to rolling out a suite of mental health support resources to their employees, and not just their employees, but the families of their employees, and even individuals who are living in the households of their employees, but perhaps are not technical family members, but those people are still affecting the lives of their employees. And so it's really an effort to cast a wider net to look at these mental health issues. We've also allowed a place on the webpage where organizations can show their commitment. They can literally fill out a form on the webpage where they provide their information about their company and provide a little bit of information about what they're doing in their own organization to promote mental health. And we don't publish the details of that on the webpage, but we do allow for an opportunity to have companies be recognized and submit their logo. You can see a few examples here on this slide. And it's just another chance for organizations to go out and see, hey, others are doing this and we should be doing this too. And if others can do it, we can do it. And it doesn't mean that the organizations have to do everything that APA and the others in the collection are necessarily recommending, but to at least strive to take some of these actions and to be in a process of continuous improvement. And what does this mean for the future of work? The pandemic certainly has helped shine a light on this issue. And that's great. At APA, we're very glad that mental health in the workplace has been elevated as a topic of conversation, but there's no one-shot fix to this issue. It needs to be an ongoing point of focus. And that's why our intent is not to let up on this issue. We need to shift the conversation from a one-shot fix to ongoing programs, and shift the conversation from perhaps a focus on just white-collar workers and Zoom meetings and so forth, and be more inclusive of the totality of the workforce. And this is not about just curing illness, it is also about prevention, and to kind of take a page from the playbook of positive psychology to really set up circumstances within the workplace where people can psychologically be the best that they can be, because the research is indisputable in terms of the gains long-term that leads to for organizations in terms of productivity, talent attraction, talent retention, and eventually bottom line financial returns. And so with that, I will pause here and turn it back over, because I know that you have other speakers as well. And I don't know if you want to have a few questions now or move to other speakers.
Yeah, why don't we go to the other speaker and then we can come back and have a good conversation. Thank you very, very much.
Sure.
So now I'd like to introduce Deborah Waldron. Dr. Waldron is the Senior Vice President for Healthy and Resilient Children, Youth and Families at the American Academy of Pediatrics.
Great. Thank you so much. Just going to share my screen. Let's see if I can get the right one. Okay. If you could just confirm that you see a PowerPoint presentation.
Yes, we can see it. If you could put that in presenter mode, the slide, there we go.
There we go.
Perfect.
Okay. Great. Thank you so much. And thank you for inviting the American Academy of Pediatrics to present some of our work on mental health. So the AAP is really committed to promoting and strengthening child, adolescent, and family mental health as a key component of optimal health, and is launching a healthy mental development initiative. It's one of our 3 critical priorities at the AAP, along with health equity and our continuing COVID-19 response. And as I'm sure you all recognize, these are not distinct priorities. There's significant overlap amongst them all, and each one impacts the other and must be considered in totality when addressing each one. The intersectionality and impact of one of these priorities on the others are inseparable, and we at the Academy believe that we want to address these with a trauma-informed lens of not what is wrong with the child and family, but what have they experienced, and how do we best build on strengths and address barriers and challenges. We know that the COVID pandemic has exacerbated the mental health crisis. As you can see, and as our previous speakers talked about in terms of their survey, there are multiple things that have the pandemic has caused and continue to cause in terms of disruptions to our lives. And ongoing stress that's created by those obviously impact families, but it impacts children as well. So what were some of the things that we know that the COVID-19 pandemic has exacerbated? We know that there's been an increase in suicidal ideation attempts. There's been increase in emergency department visits for pediatric mental health emergencies. And some of our states and our providers are reporting that Many youth are waiting in the emergency department for many days before being able to be connected with appropriate care, whether that's being seen by a psychiatrist, whether it's being seen by a psychologist, another licensed mental health professional, or being able to be admitted for inpatient care. And we know, going back to the first slide I presented, that youth who are already impacted by health disparities may be at increased risk for poorer outcomes in terms of mental health conditions. So we feel that pediatricians are in a critical position to address children's healthy mental development. And we understand that obviously healthy mental development is not just talking about treating a mental health condition. We know that it's essential to child health, and it includes many different factors. It's not just mental health, it's emotional, psychological, behavioral, as well as social wellness. And we also know that this has further impact on resilience, relationships, and healthy choices. So similar to information that was presented by my previous colleagues, we also have serious concerns on the future of children and youth and their health. We do know that obviously there's multiple complex interactions, starting with the most basic of biology and genetics. We know the environment, not only the built environment, but also the environment in terms of social constructs, as well as the stress that a family may be experiencing impacts mental development. We know that the community that individuals live in can create negative as well as positive influences, as well as the fact that childhood experiences, the trauma that a child has experienced, and again, like previous speakers have pointed out, there are multiple things that continue to go on in our world that are traumatic and traumatic to a developing brain. So we recognize that healthy mental development is across a continuum. Prenatally, we know that a caregiver's mental health and well-being is critical to child health. We know that perinatal depression, use of substances, as well as prenatal supports and care can impact the health of the mother, as well as the health of the unborn infant. In infancy and toddlerhood, we know that children begin their social emotional development, and it's always in the context of the parent-child relationship. So how do we build those strong relationships and those strong bonds early on, so that sets the environment for a healthy mental trajectory. And we do know that the childcare environment also begins to shape infant and toddlers' healthy mental development. During the preschool age, teachers and other providers continue to play a big role. And as, again, the previous speakers pointed out, we know that our teachers and educators are noticing significant declines in children's well-being, as well as their developmental progress. And then in school age, peers start to have more influence. And in adolescence, we do know that positive youth development opportunities are important. Peer relationships, as well as relationships in terms of team-related activities, become extremely important. And we do know, as you see along the bottom of the slide, that all of those things impact children as they develop. There's different social drivers of health, and we at the Academy have come out very strongly about the impact of racism on children and adolescents and their impact on their health. So the Academy has started up opportunities to increase and improve our response to healthy mental and emotional development. We're starting with 4 quadrants, we call them, and one of them specifically is around partnerships. So partnerships with individuals, organizations such as APHA, but we also have partnerships, again, with many of the groups that are here on the Alliance as well, and continue to look to strengthen those as we work in terms of our Healthy Mental Development Initiative. In terms of leadership, the American Academy of Child and Adolescent Psychiatry and the Children's Hospital Association partnered with the AAP back in the fall when we declared a mental health crisis for the nation in order to shed light on the critical need for children and families. In terms of other things, in terms of policy and advocacy, the AAP has published many different policies. I mentioned specifically the one on the effects of racism on child and adolescent health, but we have policy statements on trauma-informed care, as well as promoting resilience. And both of these topics utilize a public health approach. And then in terms of advocacy, the Academy continues to stress the support for the American Rescue Plan, as well as many different opportunities to assure that there's funding provided by our government to improve in our children's mental health services, but more importantly, those to address those social drivers that really impact healthy mental development. And then last but not least, developing professional and public education, really working with the CDC as well as other federal agencies to assure that mental health is embedded into our schools, that we continue to have programmatic work in addressing the social, emotional health and wellness of young children. And then our project that's called PATTER, it's Pediatric Approach to Trauma, Treatment and Resilience. And we're in the process of working with the CDC on developing curriculum, as well as educational opportunities for pediatricians and others in the child health space to be able to apply a trauma-informed lens to the work that we're doing. And I think I just want to leave you with a quote from our AAP president, Dr. Szilagyi, who wishes she could be here today to provide this presentation. But as she says, we cannot treat our way out of this crisis. Instead, we must take a comprehensive, coordinated approach and work with our partners in government, education, and healthcare to address upstream root causes of mental health problems and pre-existing disparities in access to care and close the gap between the need and resources available. So again, thank you so much for inviting us to present today. And I will stop sharing my screen. There you go. Thank you so much.
Thank you very, very much. I'm going to turn this over to Angie so she can moderate the discussion. Angie, thank you.
Great, thanks so much. So I will put some questions in the chat, but just wanted to start off with if there are a couple questions that people have about the two presentations or things that arose as we heard about it. Those were some great presentations, and I know I noted a lot of different facts myself about where we are right now. Anything that people just jumped out with, and let me quickly put the questions. Okay, Lori.
This is such an important topic. Thank you so much for covering it and for also sharing these resources. I just wanted to comment that, you know, we've done studies of the field of public health in conjunction with the CDC. There's a second study being fielded right now for the workforce that you'll sort of replicate the findings that you shared. So we are, and then we know that as an organization ourselves with a lot of employees supporting that workforce, that our employees are suffering from mirrored symptoms that our workforce is suffering from. And they're very intense and it impacting nearly everybody in the organization and the workforce. So we are struggling from the position of having to provide services to, or think about how we can provide services to a workforce that is suffering. And I will definitely take a look at your materials, but was wondering if you had any thoughts on how you'd address an entire workforce versus a defined set organization, because I think we're facing having to do both and do it quickly because these people are suffering in such great ways. Thank you.
Dennis or Vale, would you have thoughts?
Sure. I think that one strategy, and I'm going to say this in an abstract sense, not knowing your details, but one strategy is to identify a smaller group of leaders and disseminate information to them and get them on board with the messaging, and then in turn have them disseminate to the next group and so on, so that you're building a communications network, because it is such a challenge, as you've pointed out, to try to get the information and resources and all that out to a large group of people. You almost have to knock it off in small chunks and then disseminate it. And within a single organization, one of the things that we recommend is that training be given to a set of managers on mental health issues, and that they be encouraged to have discussions about those issues, perhaps even where questions about the extent to which they discuss those issues appear in their 360 reviews and so forth. So there's something in it for them as well. And then it's on them to then push it out further. And then from there, it gets pushed out among colleagues and et cetera, kind of creating a web of information.
Thank you. And then I wondered if I could just add one more question too, and that is, well, how do you cope with, it's one thing to answer a survey, which I think is the low-hanging fruit portion of the work, getting people to quietly admit that they might be facing a challenge that they can't cope with. It's quite another to get them to admit that a service or a program might be beneficial to them. So how do you, make that transition from, getting people who are used to being strong for other people to admit that and seek help for themselves?
I think it often involves a shift in culture, which is not easy to achieve, I understand, and it's difficult to do that overnight. But the shift in culture that begins to normalize the fact that sometimes services are needed, just like physical health services are needed, and for the messaging to come from the top, not just high-level leaders in an organization saying you should do this, but high-level leaders in an organization becoming vulnerable and saying, I did this, I needed it, and I turned to this service and it helped me. And so it could help you too.
Yeah, that was the point I was going to make too, is I think the modeling by leaders can't be overstated. I think that when you model healthy behaviors, whether it's seeking out treatment or whether it's establishing a better balance in terms of small things, even like returning emails after hours, right? That when you even set those kinds of expectations, I think you do take the small steps towards a culture change where you shift the focus away from meritocracy and more towards relationships and people. And I think that it takes time, but I think if the leaders can walk the walk, then that really does demonstrate to others that they're sincere and authentic.
Great, thank you. Ernest.
Thank you. Thank you all for the wonderful conversation. I'm president of the American Nurses Association, and we obviously, that's a big concern, is the mental health and burnout of the nation's nurses. And even though we try to put programs out there in different forms and et cetera, and talk about resilience, that's the last thing in some cases they want to hear. I view them as somewhat like the military. There's the stigma that's associated with needing help or admitting that you need help. And one of the biggest stigma, and this is where my question is going to, is of course the fact that it may be reflected on either their licensure or their insurance.
and or even in some cases maybe potential legal prosecution. If you take a look at the the recent case in Tennessee, and how that sort of played into that as well. So and even though we've been trying to work with regulatory agencies to soften the blow of that, I guess it's a matter of messaging perhaps. But then I guess my question is there anything else that you can think of that we can do in order to get more nurses to to want to seek behavioral health and not feel ashamed about it, but also feel that they wouldn't be punished for doing that as well?
Dennis, do you have thoughts, or do you want me to go?
Go ahead.
I do think that stigma is clearly a barrier. I also think in some ways it's access, because I think we don't always need to think that everybody who is having emotional challenges or mental health challenges needs to see a behavioral health specialist for 45 minutes a week on a weekly basis. I think hospitals and others can leverage their own internal behavioral workforce to come up with creative, on the spot, where they're at, types of brief interventions. We did a series of short videos at APA really geared towards healthcare workers to help them sort of identify what are some small things in your control in this moment that you can capitalize on to actually address the stress and the burnout that you're feeling. So I think bringing these interventions, whether they're creative, sort of technologically based interventions, whether they're brief peer groups that come together to discuss what they're going through, or whether it is a more traditional kind of 45-minute person-to-person kind of approach. I think we just need to be more innovative. I think we can't, like that last slide from Dr. Waldron, we can't just treat our way out of this in a traditional sense. We've got to come up with really creative ways of bringing interventions, brief, effective, evidence-based interventions to individuals where they're at. And then I think that will help, I think, address this to a certain degree.
I'll just add a quick note that it's been posted in the chat, a resource on the APA webpage that may be useful, specific to your question with regard to nurses and other first responders and so forth, and the burnout that they've been experiencing. I also think that this is an issue that involves both individuals as well as more systemic issues and policy issues. And so it is incumbent upon organizations like APA and many of the other organizations on this call to get involved in advocacy with regard to licensure requirements and what disclosures are required to be made and so forth, and make sure that the rules are consistent with a therapeutic goal.
That makes a lot of sense. Thank you. What have others seen? Anything else that you've seen in your own organizations that are issues around mental health and well-being that we need to put on the table at this point? I think it's really helpful to think about workplaces to have gotten stage set by our friends at APA, and to think about kids. I think the fact about a lot of kids being 2 years behind is really frightening. So, what do we all need to do to support those parents, those families, et cetera, as they're dealing with this, or your own employees? Nadine.
Thanks, Angie, and thank you, Georges, and the entire team for this great conversation. Something that I think is also important, and these presentations have been wonderful, and thank you for the resources, is also the recognition that as we're addressing the pandemic, there are also other areas, racial injustice, social injustice that's happening that's also impacting the mental health and well-being of our teams, and recognizing that the safety of feeling that they might be able to speak about that, or that there's an understanding from their supervisors of how that's could be potentially impacting them, their families, their communities, their friends, et cetera, I think is critically important. And whether it's in larger group types of discussions, smaller group types of discussions, or just even an acknowledgement that these events are happening, I think is something that is appreciated, to know that while we're in the day-to-day grind, there are these other life events that maybe something is not related specifically to one's mission, but we know because we know who our employees are and the relationships that we've built, that just even an acknowledgement of something that is happening in current day, I think goes a long way to show that we care about them as people.
Really important, thank you. And I see we have a question for Dr. Waldron, which is, what are some of the most innovative approaches that you've seen for kids in schools that we might be able to help to amplify for people?
Great. Thank you so much for that question. I think one of the things that we at the Academy of Pediatrics want to make sure is that schools are viewed as a safe place. And one of the things when we talk about schools are actually a workplace, and ensuring that our educators have the resources available to them to address their own mental health concerns and stress that they're facing because they're living in the same pandemic, in the same environment that the rest of us are. But things that we've seen, obviously, for older children, to have youth or peer navigators or support systems embedded within the schools, obviously done safely within the purview or oversight of either a school counselor or a school psychologist that may be there, but really to try to develop a network, a sense of belonging, a sense of safety, and a sense of normalcy, whatever normalcy means these days. For younger children, obviously, and for older children as well, but we really want to make sure that there's a space for kids to have some fun, for kids to really just not have such structured days and lives, and an ability to really just explore both through physical activity, but also through unstructured conversations with their peers. So there are innovative models that we can share. The Academy has a Council on School Health that works very closely. It's composed mainly of pediatricians, but really pediatricians that are involved at the local and community and state level, working with our colleagues in the education system on assuring that there's obviously opportunities to make the schools safe, but also opportunities for there to be access to mental health services within a school setting as well. So school settings can provide therapy, but they also can be therapeutic, meaning that if they are seen as a safe, nurturing environment for children and youth, as well as the educators that provide services to our children, that those are things that we feel can make a difference in the lives of children. So thank you for that question.
Thanks so much. One thing I've heard from everybody really is that need for this safe, nurturing environment, whether children, whether at work, etc. I think, we've had some great resources shared in the chat room, but if there are other things that you all know about or that you feel like you need, this would be a great time for people to put some things in the chat or to raise your hand and let us know, because I think what we really want to do is figure out how we can share and learn together also. So I will wait for people to put things in the chat room, but otherwise, are there other things that you all heard today that you think as a group of multi-sector organizations who really focus broadly on health and well-being, that together we need to think about how to lift up or how to increase the discussion or advocacy around?
Angie, one thing that I would mention that I think has not been emphasized a lot, but I know it's on everybody's agenda, is a lot of the two things. One, a lot of the digital tools that are particularly focused and targeting young adults and trying to figure out how do you do some vetting of those. Are there some that are really using best practices? What's kind of the professional perspective of that? That's one. And the second is the use of peer training programs that we've found in schools, in particular the mental health first aid and several other tools that are our Cypress initiative teams are utilizing with young adults have been very effective. And not only for the young adults themselves, but for their family members and their peers.
Those are great, thanks. I see a great resource from Ron, thank you. And from Luana. Okay, well, I think we're getting near the end of time, so I'm guessing there's also so many issues we're gonna be dealing with over the year to come as we deal with this. I think especially Nadine, what you mentioned around all the other issues swirling around also, not just the pandemic, but racial, social justice issues are certainly, I believe, going to continue on with our political year that we have coming up. So I think all things that we'll want to keep exploring as an alliance. But if there's anything else that people wanted to comment on quickly before we head out. And if not, I would say, please share any resources you have with us. We'll make sure we add them to Fern. We'll share them with all of you all. We really appreciate our presenters today. I know I learned a lot, and I could tell everybody else did from the comments. And so just thank you to all of you all, and we will pause our meeting next month, but we'll be back in July. So everybody have a good couple months in the meantime. Thank you.